I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Very briefly, Dr. Reagan said that he has brought data to this panel, specifically related to the brain damage. Could you, for the layman in simple terms, react to his statement that there is evidence of brain damage? Is he misinterpreting the data?
I believe that reasonable people can look at the same scientific studies and come to exactly opposite conclusions.
I don't see why it's a question. If it is a question, tell me what the conclusion is as to I think the issue of brain damage it seems to be one that keeps coming up.
Could you step up the microphone, start with
We're talking about a cultural issue. We reviewed the evidence available from a scientific perspective, and there are certain criteria that one needs to use to evaluate scientific studies. And we had a large number of studies available to us, and my background is as a neurologist and interested in epilepsy and brain damage from seizures has also made me aware over many years of the information that is available in terms of scientific studies. Now, in order to look at scientific studies, you have to have a very high standard of looking at how the study was done. And it is very clear to the scientists on the panel and the scientists in the United States studying this matter that most of the studies, the vast majority of the studies which showed brain damage, quote unquote, earlier had trouble with methodology. Fixation artifacts, it's very clear that if an animal or a person dies, there are changes that take place in the brain from lack of oxygen, lack of blood. So when one looks very critically, from a scientific point of view at these studies, it is the conclusion of all the scientists, I think, on this panel, and certainly the scientists I've spoken with, the ones I've met with before, that there is no evidence, and I'm going to limit the definition of brain damage to actual death of nerve cells. And there's no evidence in our consensus and among scientists that there are any evidence that there's any significant amount of actual nerve cell death from the amount of current that is used during electroshock. Now, someone earlier asked about basic science research. There are groups in the United States and England who've been studying the epileptic animals from rats to all up higher species, and they're all finding that very short-term pulses of electricity lasting less than a few minutes, or seizures lasting less than a few minutes, if there's oxygenation, there's no change in blood flow to the brain of any significance, there's no cellular damage. I want to also mention that it was a consensus of the panel that we're aware that there is a memory deficit. Now, we don't know what the neurological basis of a memory deficit is. It may be some rearrangement of some molecules that are important in memory. We just haven't been able to detect that. So our position is that there is no gross loss of nerve cells, which some people use as a criteria for brain damage.
Can you identify yourself so we have the...
Yes, Dr. Lepik from the University of Minnesota.
I have one quick question. That is, on the basis of that data, is ECT safe?
The ECT being safe is a broader topic. And ECT, in my opinion, does not cause death of nerve cells in the brain. ECT very clearly causes a memory deficit, which I think is a consensus of the panel.
What's your answer to the question, though, Doctor? You have an opinion, right? Safe or not?
I think it is safe if it is used properly.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope you might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding, like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factual data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun. Out with your gun.
Okay, this won't hurt. It'll be over in just a moment.
What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it. That's right. Just bite down. Now bite down on it.
Good. Are you ready? Here we go.